Hi, so you're probably watching this video because your young child has something known as nasolacrimal duct obstruction, and you have been advised by your pediatrician or by your ophthalmologist to do a massage which will hopefully break that obstruction. So what I'm going to do in this video is to quickly explain you the entire structure or the entire anatomy of the lacrimal drainage system, which is located in this area of each eye, and I will then teach you how to do the massage. So consider this diagram, and this is the left eye. So basically the nose will be here somewhere, right? And this is the black portion of the eye or the iris, and this is the part of the eye which is towards the nose. Okay, now there are two openings on the lid margin, both in the upper and in the lower lid, and these openings are known as puncta, and these puncta will lead into a tube which is called the canaliculus. Okay, and both these canaliculi open up into this area which is called the lacrimal sac, right? And the lacrimal sac leads into this tube which is the nasolacrimal duct, and this tube opens up into the nose, right? And therefore any excess tears that we have are supposed to drain from these tubes, go into the sac, go down through this tube and go into the nose. Now when your child has a congenital nasolacrimal duct obstruction, then the obstruction usually is in this area, right? So the nasolacrimal duct, which is this tube, is blocked, and therefore there is fluid collection in this tube here. All here the fluid collects, and whenever there is any fluid collection, the fluid tends to get infected, and when the fluid is infected, it'll become sticky like a discharge or like pus, and that is why you see your child always having a pus in this area, because the thing is flowing out, the pus is flowing out from here and collecting in this area. So when you talk about the massage for the nasolacrimal duct obstruction, most likely what you have been told is to do something like this, where you have to drag your finger down and you have to keep pressing the tube. The problem with this technique is that the tube is actually in the bone. So by pressing this bone, you're not going to be pressing any tube, and therefore this way of massaging frankly is quite useless. However, a better way of doing it is to use your little finger, because your baby is very tiny. So use your little finger, place one hand on the face so that you're giving some counter resistance to the pressure that you're going to give, and with your little finger you put your finger here. Okay, now when you place your finger here, you try to cover the two openings, the two puncta, okay, so that when you press like this hard, you do not allow the fluid to come out of the puncta. Okay, here I'm going to give you a similar situation like those pumps that we have to clear up clogged drains. When we put pressure on that, I don't even know what the name of the gadget is, but when you put pressure on that, if the vacuum seal is not proper, you will not be able to create the pressure to open up the block. Similarly, if you press here without covering the two puncta, then your massage may not be as effective. What we are trying to achieve by doing this is the lacrimal sac is full of fluid. We want to give a pressure to that fluid so that the fluid is forced down, and that force should break the blockage that is there, right? For that to happen, the sac has to be full. If the sac is empty, just by pressing the sac, you're not going to open the block at the bottom, and therefore there's no point doing it 20 times a day, because the sac is not going to fill up so fast. What you have to do is put your hand here, cover this part of the eye, and press it 3 times. 1, 2, 3. Okay, and then do the same thing in the evening again. And this is the only massage that you need, and that is that may be effective. You should know that if 100 children have a congenital nasolacrimal duct obstruction, about 80 will get better just by doing the massage. All right, so hopefully you find this video useful. and you should be following this way of doing the massage to get the best result possible. Thanks for watching.